The first question I have is, what effect will Obamacare have on businesses in general?
Well, the first thing you're going to see is a number of businesses decide that they'd rather pay the Obamacare penalty, the Affordable Care Act penalty, which can be anywhere from $2,000 to $3,000, depending on the business, than buy somebody's insurance, which might be $13,000, $14,000. So you're going to see, in a number of surveys have shown this already, a number of businesses say, look, we're either going to just drop the insurance, or we're going to give you a cash supplement, a stipend, $5,000. Sears Holding, Darden Industries announced last week that that's exactly what they were going to do. They'd give their employees $5,000, which of course they can deduct, and pay the penalty, which might be $2,000. So they're out $7,000 in labor costs. Still saves them $7,000 if the insurance policy is $14,000. So you're going to see a number of people flooding to the Obamacare insurance exchanges, which when they fashioned the bill, they were estimating how many people would do this because, as you know, they subsidize those people up to $90,000 depending on how many children you have. So I think the great impact on business and on employees is going to be a move towards the exchanges as opposed to getting insurance at work. And secondly, the exchanges are going to be flooded, which means the subsidies are going to be a lot larger than the administration planned, which means the whole bill is going to cost not $1 trillion, but probably $2, $3, $4 trillion. Nobody really knows.
What about, on a bigger level, society as a whole? What's going to be the impact? If it doesn't get repealed, if it goes through the way it is now, what do you think the impact will be on society?
Well, obviously the danger here is, in my view, rationing. What you've got is a way to pay for the bill. As you recall, the administration said this is a $1 trillion bill, but it's not going to add to the deficit. And the reason it wasn't going to add to the deficit is because the plan has a number of tax hikes, the flexible spending accounts, the Cadillac insurance tax hike, the medical devices tax hike, the medicine cabinet tax hike under health savings accounts. A lot of people used to be able to deduct their over-the-counter medicines. You can't do that anymore. So a lot of previous deductions are taken away. There's some outright taxes on medical devices, which is going to hit hard here in Minnesota, as you all know. That was going to raise about $500 billion, maybe actually about $400 billion to be closer to the actual figure. Then you had the Medicare reimbursement payment that they decided to simply stop doing. That was the $716 billion that during this campaign the opponents, Romney and Ryan, are saying are coming out of Medicare. So what the administration said is, we're going to spend $1 trillion on the Affordable Care Act, Obamacare, but it's not going to add to the deficit because we're going to raise revenue with the taxes, and we're going to simply reduce Medicare payments and take that money we saved and put it in Obamacare. And the problem, of course, with that is, if you are a doctor or if you are a clinic or a provider and you say, oh gosh, if you treat Sally or Bob or Bill, we're going to pay you the full reimbursement of the insurance network or the market rate. But if you treat a Medicare patient, but guess what? The government says we're going to pay you half the going rate. The obvious result of that is you're going to have a number of providers saying, we don't want to treat Medicare patients. We don't want to treat, and in fact, it's already happening right now. Medicaid and Medicare reimburse way below the market rate that insurance companies pay or individuals pay. That's going to go even further. You've got one particular survey that Governor Romney pointed out the other night that says 50% of doctors are not going to take Medicare patients. They're not going to add to Medicare patients if this bill goes through. So what happens then is you've got fewer providers. You've got fewer providers, but you've got more patients. Supposedly, because of the Medicaid expansion and the insurance exchanges, we're adding 30 million now, 30 million more people to the insurance rolls. What that means is, of course, you've got more people queuing up and less supply, fewer providers. That is de facto rationing. That is something that a lot of the critics of, quote unquote, a single payer system or even Obamacare say happens in Canada, happens in UK, where you've effectively subsidized this product so much that the demand has risen and supply can't keep up with the demand.
Could the government step in and force hospitals to take these customers?
Well, I don't know how you force a doctor to go in business. How do you force anybody to work? That's one of the dangers of socialism, to be honest with you. It always ends at the point of a gun, because in the final analysis, the only way to get people to do something they don't want to do is to force them to do it. So that would be a draconian draconian remedy. You can. It already happens here in Minnesota with MinCare, for instance. If you want to treat unemployment insurance, or not unemployment insurance, but workers' comp patients, if you want to do this or that, you've got to take MinCare patients. So the state has a number of ways to say, okay, you don't have to do anything, but if you want this and this and this. But then in the final analysis, if you're a young, bright individual and you say, well, I could go to medical school and go into debt for $200,000, then come out and make $70,000 a year because that's all the government's going to reimburse me for. Or I could go into business. You're going to see fewer specialists, fewer providers, and that is, as I say, de facto rationing.
All right. So what would you say about small business? How will the healthcare affect people in small business?
Well, and again, it's going to be a big tax increase. The single biggest problem in the business community right now with the Affordable Care Act is uncertainty. They have no idea how it's going to be implemented. It's a little bit like Dodd-Frank for every business. They have no idea how it's going to be implemented. They have no idea what the costs are going to be for certain. But I can tell you the moral hazard that's induced by all of this is the penalties are, and this is a very ironic thing to say, too small to have an impact. So whether you're a small businessman or woman, or whether you're an individual, you can pay a $700 fine if you're an individual, and because of the pre-existing condition mandate, you can get insurance anytime you need it. So this is the great fallacy in the whole legislation. I'm an individual and the government comes to me and say, you've got to have insurance, and Justice John Roberts says the government can tax you until you comply. So I've got to have insurance. But the insurance company can't deny me if I'm already sick. So it's a little bit like, your house is on fire, you don't have homeowner's insurance. Now you call the insurance company and say, oh, by the way, I need insurance. Well, in a normal insurance market, they're going to say, sorry, insurance is about buying before the event. We're not going to cover you. But in health insurance, we say, oh, no, you can just wait until you're sick, and then you can call and get it. So think about that for a moment. Now, since I can't be turned down, and the penalty is only $700 for the individual. It's about $2,000 for the business, as we mentioned. $700, I could buy an insurance plan for $10,000 and pay in and pay in and pay in. Maybe I'll never use it. Or I can pay $700 a year, pay the fine, wait till I need the insurance, wait till I get sick, and then since they can't deny me because I have a pre-existing condition, that's what I'll do. Well, that, of course, bankrupts the entire system. Insurance is about pooling resources. And so you're not going to have any resources going into the system from healthy people for those who are sick. People are going to wait until they're sick, and they're going to pay the fine, which is not high enough to fund the system. So that's the irony of the whole system is the fines would have to be the cost of insurance in order to get people to buy insurance. And since they aren't, everybody's going to scam the system. And you're going to have these massive budget outlays because everybody in the system now is going to be sick, or they're going to wait. So the cost of the plan is going to be much, much higher than they anticipated because of that. And the same is true for business. If I can insure you for $10,000, $15,000, or I can pay a $2,000 fine. What am I going to do? So you're going to see everybody offloaded onto the insurance exchanges just when they're sick, and at that point, the system I don't think is going to work.
What if they just decide, or what if they see that trend happening and they just decide to move the penalties up to those levels?
Yeah, they could do that. It's not in the offing now, but remember, this was not supposed to be a tax increase on the middle class. We already have that, by the way, the 40% Cadillac insurance tax, which is going to take effect in a few years. All of the taxes I mentioned before, the medicine cabinet tax and the medical devices tax and all that. But now if you raise these fines and it's hitting middle income people, there goes the president's promise on not taxing the middle class. Frankly, I think he already has, but this would be much more explicit.
Do you think our current healthcare system prior...
And by the way, given Justice Roberts' ruling, a penalty, what he said was, if the tax is essentially reasonable, the government may do it. He didn't say that if the tax were $10,000, he'd uphold it. So that would be another thing to consider.
At this point, would he be able to go back on that? Because, that seems like a subjective, it's a relative term. How would you get it back to where he could...
No, somebody could bring another case and it would have to work its way through the appellate system. But somebody would bring another case and say, okay, now the tax is onerous. Now it's no longer reasonable under the government's plenary power to tax and spend. It has to have some relationship to a program. It has to have some relationship to be reasonable, and then someone could say it's not.
Okay. Do you think that prior to Obamacare, our healthcare system, do you think it's good in general?
Well, yeah, I mean, most states have high-risk pools, like Minnesota, MCHA, which says they get an insurance company and they say, look, we've got people with these conditions and they're having a hard time getting insurance in the individual market. Remember, under group plans, under HIPAA, you've got guaranteed renewability. So if you keep your insurance payments up, they can't deny you under group plans, and that's where most people are covered. But even if you're in the individual market and you're having trouble getting insurance from someone, they turn you down for whatever the case might be. Under these high-risk pools that a number of states have, and they work pretty well, they contract out with the insurance industry. One insurer comes in and says, all right, I'll take everybody, but I get to charge 125% of the normal premium. That's the way insurance works. As I mentioned, it not only pools risk, insurance is there to price risk. So if you're running into the neighbor's car every other week, your car insurance is going to be higher. Would anybody dispute that that would be the case? Sure, it should. It is a way to regulate behavior, a way to encourage people to shape up. So in healthcare, the same thing ought to be true. That if you're filing a claim every other week, if you're going to the emergency room for getting your hangnail removed, if you're essentially consuming too much medicine and you're not taking care of yourself, you've got weight problems, or you're drinking too much, or whatever the case may be. And not all of that is possible. I mean, sometimes bad things happen to good people. But we all know about the quote-unquote obesity crisis from the same people that sold Obamacare say we have obesity crisis. Well, in most cases, not all, in most cases, that's self-inflicted. So allowing the insurance markets to price risk would give that sort of disincentive to be unhealthy. And the high-risk pools do that. They say, all right, we're going to grant you insurance, but you're going to pay a little more. Now, who's against that? Well, I guess people who think there ought to be a free lunch are against that, or people who believe that health insurance is a right. But then again, you go back to inducing the moral hazard. If health insurance is a right, and I can command a doctor in a hospital and a clinic to work for me for free, why should I have to pay anything? And I'm not going to. And that's the problem with the pre-existing mandate in many ways. So what is the solution for pre-existing conditions? These high-risk pools is a good one. Reinsurance is a good one. You know, the irony, now that you got me going on this with regard to Obamacare, is it's halfway to a market reform. And I do think that those opponents of Obamacare who are running around saying repeal the whole thing are probably making a tactical mistake. You wouldn't have to do a whole lot to turn this into a market-oriented system. Because the net effect, I mentioned what Sears and Darden Industries, which is a big restaurant chain, what they're doing, they're moving people into the individual market and paying them for cash. Well, a lot of us on the so-called right, or the free market types, have been saying we need to move towards an individual market. I don't get my automobile insurance at work. I don't get homeowners at work. Therefore, it's portable. If I switch jobs, I don't lose my automobile insurance. I don't lose my homeowner's insurance. But only because the tax code is as it is, only because coming out of World War II we had wage and price controls, and the only way to attract labor was to give them a freebie, health insurance, we now have a system where you're kind of captured. The only place you can get insurance is at work. What some of us have been advocating is moving that system so individuals can buy insurance and make it affordable. So the first thing you would do is change the tax code. So instead of the corporation getting a tax break for providing insurance, I would get it. I go out in the private market, I'd be able to deduct my insurance premium. And if you want to help the poorer folks, make it a refundable tax credit. Now, ironically, Obamacare does this. It is a system, an insurance exchange, where people go and buy insurance from private insurance companies. Now, instead of getting a tax deduction or a credit, they're getting outright subsidies, hence that adds to the cost of the program. But you aren't seeing the effect, the unintended consequence of people being moved into the individual market because the penalties were lower than the cost of insurance. So you're going to see a bunch of people in the individual market. If you could get a conservative reformer to come around and say, all right, tell you what we're going to do. We're going to reform Obamacare and make it, be politically savvy about this. We're going to reform Obamacare, and we're going to, in fact, say, leave the insurance exchanges up there. We may have to reduce some of the subsidies because it's bankrupting the system, but we're going to change the tax code so that everybody on those exchanges, everybody in the individual market, they get a tax deduction regardless of income. They get a tax credit if you are poor, or if you need a refundable tax credit perhaps, which would be in effect a subsidy. But if you do that, and then, this is key, then you remove the pre-existing condition mandate. You rely on the high-risk pools to cover those maladies. You rely on reinsurance. So that now, and the reason I say that is so people could buy on the exchanges what we used to call major medical. Right now we have the mother of all mandates, the pre-existing mandate, and you have a number of mandates statewide. I mean, if you take a look at the state mandates here in Minnesota, if you take a look at all of the things a traditional indemnity insurer has to cover, it prices well, if you're 25 years old and healthy, it prices 90% of those people out of the market. Because you have to cover all sorts of things: chemical dependency, substance abuse, AIDS coverage, removal of port wine stain, whatever that is. You've got to cover all of these mandates because liberals in the state legislature think that's being compassionate. All they've done is drive up the cost of insurance. So now let's say you've got this individual market paradigm. You've got people on the exchanges trying to buy insurance, but because of the pre-existing condition mandate, because of all the Minnesota state mandates, they can't afford it. So you need all these subsidies. You remove those mandates, so now I can buy, I'm 25 years old, I'm healthy, I'm not going to be a substance abuser, I'm not going to get AIDS, I'm not going to become pregnant because I'm a man. You got all these mandates removed, all of a sudden you can buy a policy for $190 a month. Now what's it going to cover? It's going to be a cafeteria style policy. It's going to cover if you get hit by a car, it's going to cover cancer, it's going to cover heart disease. We had this when I was a tiny tot. It was called major medical. Most families had major medical. It did not cover a first dollar coverage for your kid's physical for the football season. It did not cover your annual physical. If you can afford $250 a month for a cell phone, you can afford going to your GP and pay $100 for an annual physical. So it returned us to a true insurance market. Right now we have prepaid medicine. What we need is to go back insurance so that a young person who's healthy doesn't need all of the bells and whistles. All they want is, God, if I come down with cancer, I'm going to have coverage. And you can buy that with a high deductible. You pay the copays. You would have to remove all the mandates, but you could keep effectively the exchanges and what Obamacare is going to do by moving people to the individual market. So if you reform this system, you could actually move it towards a more, shall I say, liberal market when I'm talking about more freedom, more choice.
Okay, so in the debate, when Romney mentioned that we have the best healthcare system in the world, so why would we change it the way we are?
Right.
I noticed on Twitter, Bill Maher mentioned that the UN ranks our healthcare system like 37th in the world.
Right.
Number one, is that true? And number two, what are your comments on that?
Well, of course, anything coming out of the mouth of Bill Maher is by default false. But secondly, if you're relying on the UN statistics rate how many people have to pay for it. So the UN doesn't think people should pay for health care. The UN doesn't think people should pay for transit. The UN doesn't think people should pay for shelter. And if Bill Maher wants to help people pay, he ought to instead donate $1 million to Priorities USA. He ought to be donating to somebody who needs health care. He doesn't do that. All he does is run his mouth on a show nobody watches. I don't have a lot of time for people like Bill Maher. But the larger point here is, if you think health care ought to be free, then the UN rankings is something you look at. But nothing's free. Somebody's going to pay. And so if you're not paying the doctor, you're paying taxes so the doctor can get lower reimbursements and so you can wait in line to see him. But you're still paying. Somebody's going to pay. There's no such thing as a free lunch. What people like Bill Maher never tell other people is, we have, prior to the Affordable Care Act, we had 30 million uninsured. First of all, it was 46 million, according to Mr. Maher and the president, until they realized, whoops, we got a lot of illegal immigrants in there. Okay, let's bring it down to 30 million, because that was embarrassing, saying they wanted to cover illegal immigrants and the uninsured. So then they said, well, 30 million uninsured, but we're going to cover those people. What they never tell you is, we set a record last year for the number of people who had insurance. I believe the figure was 260 million, but I may be off on that. But it was a record. So they never tell you that the good side. Look, the bottom line is this when it comes to health insurance. The socialists out there, like Mr. Maher and some in the administration, will tell you that the free market healthcare system doesn't work. Here's a news flash. We haven't had a free market in healthcare since 1945. In 1945, when we had wage and price controls at the height of the war, effectively what the government said, because they wanted to devote resources to the war effort in the 40s, they said, employers can't offer you more money, and you can't raise prices. So what did employers do at that time? They said, well, we can't pay you more because of wage and price controls, but we'll give you insurance. That wasn't considered a wage. So they gave free insurance. After the war, that continued, and then we changed the tax code, which is not exactly free market. Taxes by definition are intervention in the free market. We changed the tax code to say, okay, employers can deduct what they give employees for health insurance, and by the way, employees who get the health insurance don't have to pay taxes on it, even though it's income. That is not free market health care. Then you had all of the mandates, some 2,000 to 3,000 that states have put on it. You now have the mother of all mandates with Obamacare, none of which, by my definition, has anything to do with the free market. So right now, if I want to buy a cafeteria-style healthcare plan, again, going back to that 25-year-old who's been priced out of the market due to government intervention, and I just want coverage for the big stuff. I'm healthy. I don't go to the doctor but once every 3 years. I might go for an annual physical, but I might not if you were like me when you were 25. I can't buy it. I can't buy just a policy that we used to call major medical. It is illegal. I can't find it. I can't buy across state lines. I've got to buy a Cadillac policy that the compassionate left has loaded up and priced me out of the market. That's why people don't have insurance. That's why young people don't have insurance. Why on earth would I pay $15,000 a year when I'm consuming $1,000 a year in health insurance? It doesn't make sense. If you could lower the cost of insurance for young people, they'd buy it if it were $190 a month. So this has nothing to do with the free market. It has nothing to do with the system, the American system that's failed. It is a failure of government intervention. You know, liberals are really adept at this. What they do is they intervene in the free market, whether it's education, whether it's energy, whether it's healthcare, just enough to screw it up, and then they blame the free market. And that's exactly what's happened here. And so, you know, if you've spent a minute listening to Bill Maher, you've just wasted a minute.
If you were to reform our healthcare, what would you do?
Yeah, again, what we've got to do to reform healthcare is go back to A, a traditional insurance market, and B, an individual insurance market. As I say, people don't get their homeowner's insurance at work. They don't get their automobile insurance at work. They don't get life insurance at work. Why do we get health insurance at work? Because the government has set up a system through regulations and a tax code that makes that the only feasible way to pay for the system. Now, if you went back to a more of an individual market, in my view, and your employer pays you $10,000 in cash, which, by the way, they can deduct, instead of $10,000 in insurance, and then you get the cash, you buy an insurance policy, whether you want a Cadillac-style plan or a major medical plan, a very, very slim plan. You could either keep the excess money, or you could pay a little more than the $10,000, and then you could deduct that. Why you would open up the system into a more traditional market. We don't hear people complaining about the price of cosmetic surgery, about the price of dentistry, about the price of all of those procedures that aren't covered by insurance. No, why is that? Because there's a vibrant market that is driving consumers to find the best price. And so if you eliminate the mandates, the left has sold the country, not on insurance, on health insurance. They've sold the country on something called prepaid medicine, that you shouldn't have to pay anything. We ought to have first dollar coverage. You go to the doctor and your first copay ought to be zilch. The first dollar they charge you ought to be covered. No other insurance market operates that way. Your automobile insurance doesn't cover oil changes. Your homeowners, that's a big deductible. You know, imagine if you had a house and it's worth $200,000 and you had an insurance policy on it from day one, first dollar coverage that covered it for $400,000. Might be a lot of home fires. You'd make a quick $200,000. So what do? They say, oh, no, we want you to have some skin in the game. We're going to cover your house for replacement value of $150,000. So you might be out $50,000, but you're not going to be out the whole thing. That's the way insurance markets fundamentally work, except in healthcare. In healthcare, we've got no skin in the game. So what you need is to get people to be able to buy a slimmed down plan, especially young people, that in fact would require people to pay for the routine medical expenses. Now, politicians don't like to say this because they like to give things away. but at some point we've got to inject a little personal responsibility. The beauty of that, however, is that if your insurance is going to cover your major medicals that would bankrupt you, but you're responsible for the routine expenses, like you're responsible for your heating bills, your cell phones, your cable, whatever. Guess what would happen? Overnight, you would see healthcare costs go down. Because you know what? If Susie needs a physical for this year's swimming program, and my local doctor says, well, we're paying these out of pocket because we've got a major medical policy. How much is your physical? Oh, it's $150. Really? A guy down the street, good registered doctor, a certified doctor, is charging $100. Really? I'll match that. And all of a sudden, like in those areas that aren't covered by insurance, in cosmetic surgery and laser, all of those technologies where prices have come down, you would see that come down. But compare that to the system we have now. First dollar coverage by a third party, either the government. Remember, Medicare, Medicaid pays for 49% of all healthcare expenses in this country. If you've got a third party picking up the tab, whether it's your insurance company or government, do you care what it costs? My GP says, oh, that physical's $300. I don't care, I got coverage, don't worry about it. Take another test? Well, am I covered? Yeah, you're covered, go ahead, take another test. We get overconsumption because somebody else is paying the bill. So why shouldn't there be some sort of market discipline in healthcare? And there are only two ways to get that. There's two ways to get that. One, you can have consumers and providers decide among themselves, is this worth another test? Your doctor might say, look, I've seen this before and I can guarantee you, you're not going to come down with a major illness. But if you want another test, we can do it. It's going to cost you $500. Well, you know what you're going to say if the insurance company is covered or if the government's picking it up. Let's do the test. But if you've got to pay it and the doctor says you really don't have anything to worry about, you're not going to do it. You're not going to overconsume. And that's one way to handle the costs. The other way to handle the costs is what, quite frankly, the Affordable Care Act is going to do. And that is to say, well, we're going to have the government, through subsidies, cover it all. So take that test. And you know what happens? Pretty soon, you run out of clinics. You run out of doctors. You got people queuing up. Everybody's over-consuming health care. Now, what's the government to do when the Obamacare subsidies are not $1 trillion, they're $2 trillion, they're $3 trillion. They're going to do exactly what they've done in the United Kingdom, what they do in Canada. They're going to say, this test is not covered. This test is not covered. We're not going to pay this claim. They're going to ration. That's exactly what they're doing. In fact, the Center for Medicaid Services, or Medicare Services, already denies virtual colonoscopies. Now, a lot of people don't like the invasive procedure of a colonoscopy, not exactly a day at the beach. So they do virtual colonoscopies. Center for Medicare Services says, no, we're cutting back on that. So you could, healthcare, here's the dirty little secret about healthcare and about any other product in the free market. It is allocated. That's a fancy word for rationed. How does somebody at the hardware store know how many wrenches to make? You don't want too many wrenches, and you don't want too few. That's rationing. That's allocation of resources. They do it through the free market. So that's one way to do it. Or you can do it through government, where they can decide, a Soviet 5-year plan. Those are the only two ways to decide how many services are going to be available. And I think the market's a better solution. So if you change the tax code, you allow people to buy major medical policies that with high deductibles that just cover the big stuff, right? You're going to solve 90% of the problem. You're going to have health insurance affordable for young people, for single people, and indeed, you would even solve the pre-existing condition, because if people keep paying this, in the system, they don't lose it because they lost their job. You're going to have guaranteed renewability in a number of places.
Is the healthcare law going to make people healthier, and is it going to bring the costs down?
No, I think you're just going to see an overconsumption of healthcare, to be honest with you. Look, we all know that people aren't denied healthcare in America, because if you are a nonprofit hospital, in order to keep your tax-exempt status, you not only have to treat people that come to the emergency room, you have to treat people that can't pay on a routine hospital admission. Now, if you're a for-profit hospital, the rules are a little bit lax, where you don't have to take everybody, but you still have to treat people who have an emergency. So it is a total Bill Maher fantasy that people aren't getting health care in America. We're just having somebody else pay for it. So now what they're doing is they're going to say, we're going to create this pseudo insurance market where supposedly those people who are going to the emergency room or going to the hospital for free, instead of being paid outright by the taxpayer, why, they're going to chip in a bit. But they're not going to chip in nearly as much as it is going to, the penalties are so low, $700 million for the, or $700 for the individual, a couple of thousand for businesses, won't begin to cover it. So the subsidies are going to indeed be overwhelmed by the costs. And before, you had a little bit of market discipline. I mean, before, quite frankly, if you weren't covered, you wondered about it. You weren't going to the emergency room every day. Now, when everybody gets what they want, you're going to have people queuing up at the clinics, and other people are going to be waiting in line to get service, and I don't think it's going to be a healthier country.
So specifically, since the audience, the main audience for this is people in Hastings, what would you tell them as far as their life, why this is a bad thing and why they should care? Well,
the bottom line is getting health care when you need it. That's whatever system you design, and that's why I believe the market system is superior, are the procedures, is the doctor going to be there when you need him or her? That's the bottom line in healthcare. We can have gasoline at 50 cents a gallon, but there's no gasoline in California right now. It's cheap, but you can't get it. Doesn't do you any good. So how best do we provide or make certain that people get the services? I mean, there's one reason that people come to the Mayo Clinic from all over the world. There's one reason that America is a safety valve for Canada, where you've got many more procedures, many more devices in America than you do Canada, so they come across the border and they get service here. There's one reason we lead the world in medical development and pharmaceuticals, is because there's a profit incentive. We actually pay people who provide this. The fallacy of a universal system is that you can get people to work for free, is you can get people to indeed take a lower reimbursement rate. We're going to cut reimbursement for Medicare patients in half. We're going to cut reimbursement for Medicaid. They already get reimbursed much lower than the private market. So the fundamental fallacy is that the left assumes people will work for free, perpetually for the benefit of the collective. People don't do that. It's not in our nature. People have a healthy self-interest. They want to work for themselves and their families, and they want to get out there and provide for the rest of the community, but in order to make their lot in life better too. If you take away that latter portion, that you're not going to improve your lot in life, but you're still supposed to provide, well, we've got great experiments with that. It's called Eastern Europe. It's called the Soviet Union. It's called all those experiments of collectivism on the right or the left. So in the final analysis, why people in Hastings or Minnesota or the country should be concerned is, at some point, people are going to quit providing health care. They're going to quit providing the services. You're going to be waiting in line. You're going to have rationing, because nothing is free, and people will not work for free. So if you think you can keep telling your surgeon, keep telling your podiatrist or whatever, that they're going to get reimbursed less because the government can't afford to keep paying them, but I want you to keep coming to work and keep giving me great service, I don't know where else that works. It doesn't work. That's the danger in a universal style system that we are drifting towards.
Even Obama said before he was president, that a mandate would hurt the middle class, because you're forcing people that don't have health care. You're finding people that don't have health care. So you're hurting people that are already in a bad situation. But now, obviously, he changed his position on that. Do you think that the reason they're even implementing this is to put private health care out of business?
Well, the criticism the president got from the left was that they didn't put private system out of business, or the private enterprise out of business. The criticism the president got from all of the liberals in the Democratic Party and academia was, why don't we have a universal system that's administered, run by government, the doctors work for government, and then we could really set their wages. Then we could really allocate where the resources are going. And the president obviously couldn't get that through, so he developed a system of subsidies for private delivery of health insurance in the marketplace, but the subsidies still distort that particular delivery. And since the government now pays 49% of all healthcare expenditures through Medicare, SHIPs, Medicaid, they still have the control of not reimbursing those. Now, and what, of course, is going to happen is down the road, I fear, and it may be in the bill as well, that they can simply say, well, if you bought your health insurance from the Obama exchanges and you get a government subsidy, and your clinic, your doctor is treating somebody who gets a government subsidy, you can't charge them more than X amount. which would be, once again, same thing they're doing through Medicaid and Medicare right now, which means you're going to tell doctors to go to medical school, to spend 3 or 4 years in residency, do an internship, rack up $200,000 in debt, and then get out and have the government set your wage. It's not going to work. It's not going to do it. Why do you think that there were shortages in bread lines in the Soviet Union? Why do you think there was no electricity in North Korea? When you remove the incentive, when you remove the profit motive, when you tell people that no matter how hard they work, they're not going to get ahead, they don't work. And I don't know how many times we have to learn this lesson. But if we don't change things with regard to health care, we're going to learn it again.
I would say that the majority of people probably don't realize that part of Obamacare was also taking over the student loans.
The going direct, right?
Yeah, can you tell me why they did that and what the goal is there for the government?
Well, it's I don't know if it's similar to Obamacare, but the nationalization of the student loan program, which by the way, defaults are now pushing 10%. Even for nonprofit traditional colleges and universities, was that you had a system of subsidies and guarantees, not so much subsidies, but, well, to a degree subsidies, but guarantees for private banks to make the loans. So the private bank would make the loan, and if the student didn't pay it back, why then the government would guarantee the loan. So you can make the argument that, look, we were already bailing out these loans and the banks already had a guarantee. However, the bank still had some leeway into making the loan or not. Because, you know, if you make a loan, you got to service the loan, then even if the government guarantees it, there's still more paperwork. It still becomes a hassle. So what happened was that the government stepped in and said, we don't like the fact that even though some of these loans are defaulting, you're making a profit on some of these loans. So they squeezed the profit margins. Even though they guaranteed the loan, so the bank ostensibly couldn't lose much money, they still squeeze the profit margins. You can't charge more than this, more than this, more than this. All the paperwork, even with the guarantee, and some of the risk. I mean, there's you know, you've got a lot of labor invested in this. The bank said, we're not going to continue making the loans. And that, some say, was by design with regard to the administration when they started to squeeze the banks on administering or lending out the money. So once the bank said, we're getting out of the student loan business, it was pretty easy for the administration to come in and say, well, see, the banks aren't providing the loans, we're just going to nationalize it. Which means now that there's no underwriting discipline. Which means now, see, people have to understand that capitalists invest for an economic return. If I'm out there in the free market, I'm not going to give you money, loan you money, unless A, you're going to be profitable to give yourself some money and to pay me back to service the debt. Politicians don't invest for an economic return. They invest for a political return. They invest not to make money, they invest to get votes. So by definition, when the government bails out General Motors, really they didn't bail out GM, they bailed out the UAW. In fact, there was a story, and I don't know if it's an urban legend or not, but I believe it, that there was a GM plant in Massachusetts, and GM was trying to contract, and they wanted to close the plant. Enter Barney Frank. Gives a call and said, look, we bailed you out, you're keeping this plant open. So you have these business leaders saying, the plant's losing money, let's close it. You have a politician saying, those are votes, they're going to be out of a job. So we're going to keep an inefficient plant open. Politicians invest for a political return. Capitalists invest for an economic return. So now you've got the government administering student loans. You think they're going to just only give loans to people who can afford to pay them back? No. People that aren't going to pay them back vote too. So you're going to have no underwriting standards at all. You're going to have massive defaults and massive taxpayer subsidies. And that's just the way they do it. And so people need to understand that nationalization doesn't work too well.
Do death panels actually exist?
Well, death panels, that famous Sarah Palin phrase was deliberately provocative, and I'm not altogether certain that's the best way to engage the debate. But if you get down to the point where the Independent Advisory Board, which is a part of Obamacare, where they're looking at best practices, the best practices on how to deliver medicine. If you get to the point where the budget is busted, if the Affordable Care Act doesn't come in at $1 trillion, but comes in at $3 trillion, and all of a sudden the actuaries are saying, we can't afford this, it's swallowing up the budget, the Independent Advisory Board is going to say, oh, in addition to virtual colonoscopies, we're not going to cover this and this and this and this and this. Well, if you say you're not going to cover a procedure, Is that a death panel or is it rationing? You know, pick your vernacular if you want, but it's not good if you need the procedure.
Okay. What would you say are the chances of repealing Obamacare?
Well, you would need a real political mandate. You would have to have such a sweeping electoral victory that you'd have a lot of political capital coming in to do it. As I mentioned, I actually think it could be reformed, and I think perhaps strategically that's the way people ought to start talking about this, that there are some good things in here. Now, even though you might think that 5% of it's good and 95% of it's bad, which I do, you can still make the political argument, there's some good things in here, we're just going to reform it. And the way I would reform it is I would again, remove the mandate so that you can buy a cheap health insurance policy that just covers the biggies. I would change the tax code. I would maybe scale back the subsidies and replace them with deductions. But, you know, look, in the final analysis, if the penalties for this encourages employers to pay people in cash instead of providing them free health insurance, I think that's a step in the right direction. So we move the system to an individual market the way automobile insurance is, the way homeowners insurance is, the way life insurance is. So you take that fundamental paradigm and you tweak it, and I think you can come up with something that would be more suitable to the free market.
The last one here I think that I have in healthcare is, will the cost structure affect people differently based on their income?
Oh, absolutely. The way the insurance exchanges are is you get a sliding scale of subsidies. And if you are a family of 3 with 1 child, and you go out in the insurance exchanges and you buy health insurance, they'll give you a subsidy this far. 3 children, you get this subsidy. Up to, I think, 6 children, but the top subsidy, you can make as much as $90,000. So we're going to be subsidizing families making $90,000. That's going to be a lot of money, a whole lot of money. And this is where the law of unintended consequences hit. They assumed X amount of people would go to these exchanges because they assumed that, oh, businesses won't want to pay a fine. Individuals won't want to pay a fine, but businesses won't want to pay a fine. They'll keep providing insurance. We're already seeing just the opposite. We're already seeing a number of businesses saying, we're not going to provide insurance. We're going to pay the fine. You're on your own. The insurance exchanges are going to be flooded, which means the dollar amount of the subsidies are going to be much greater than what they told us they would be. And that's the real budgetary problem with the Affordable Care Act. It's going to bankrupt the country.